Ever heard of PCCN? No? You're not alone. Most nurses don't even know it exists, let alone how it can transform their career. In this video, I will be sharing how I passed the PCCN exam without burning out, and you can too. Before anything else, let me introduce to you my brand new channel, Beyond Bedside, where I would tackle anything from career growth, personal finance, leadership and management, and all the juicy stuff that your nursing school wouldn't teach you. If you're thinking about leveling up your progressive care nursing, I will walk you through exactly how to qualify, prep, and what score is needed for you to be able to pass the certification. PCCN by acronym means Progressive Care Certified Nursing. It is a certification given by AACN or American Association of Critical Care Nurses that validates your knowledge of nursing to hospital administrators, patients, peers, and to yourself. It is to promote excellence in the field of progressive care nursing. Requirement number 1, the nurse should have an active and unencumbered RN license. So that means that when the board will look up for your license, the expiration date of your license should be beyond the date you're applying for the exam or taking the examination. While on the other hand, when we say unencumbered, your license is not subject to any other kinds of disciplinary action by the boards of nursing of the states you're working at. For requirement number 2, you actually have 2 options. Either you do the 2-year option and the 5-year option. For the 2-year option, the boards is requiring you to be able to contribute at least 1,750 hours in the last 2 years, and 875 of those hours to be taken in the last year preceding the application. While for the 5-year option, the boards is requiring you to be able to provide 2,000 direct care hours of acutely ill adult patient in the last 5 years, 144 of those hours taken in the last year preceding the application. So to give you an example, let's say for question 1, only 90% of test takers able to answer it correctly, then they would assign a 90% or 0.9 for that question number 1. And yes, you hear me right. For each and every question, it is not assigned with a whole number 1. It could be less than that. Question number 2, only 50% of test takers are able to answer it correctly, then they would assign a 50% or 0.5 for that question number 2. Let's say for question number 3, only 3% or 30% of test takers are able to answer it correctly, then they would assign a 30% or 0.3 for question number 3. They would add all of this number and then divide it by the whole number, which is the total number of exam, that is 125, and that will be the pass score for a certain period of time. So if you're curious, is the exam easier just because the pass rate or pass score is lower for this year? Because you may be thinking, madali lang yung exam kasi I only need to pass 66% or 82 correct answer to be able to get a certification. But actually, it is more difficult. Why? Because among all of these questions that AACN has laid out, only 66% of test takers are able to answer them correctly. So yes, the exam is more difficult the lower the number is. And the last segment of the requirement would be more on the technicalities. I know I keep on mentioning direct care of acutely ill adult patient. This only means that you should be working in an actual progressive care unit or step-down unit. If you are working in a med-surg unit or a critical care unit, then you may not be allowed to take the examination. Also, these clinical experiences should come from a US-based or Canada-based hospital. If you're working in Middle East or in Europe, then you are not allowed to take the examination. And lastly, these clinical experiences should be verifiable by AACN with the hospital through your supervisor, colleagues such as nurses and physicians. Number 4, and you'd be happy hearing this from me, is because when you have this certification PCCN, then you can add next to your name or under your name the word board certified. And why it's a big deal is because these two words, board certified, is most often used by physician organization. In nursing, there's a lot of certification bodies. If I'm correct, it's 34, but only 3 can use this term board certified in their specific program or certification. Isn't it good? Alright, that's a wrap, and this is my first video ever, and I'm so happy that it would be out there soon. A lot of learning the past weeks, actually the past months, from script writing to public speaking, arranging all my lightings, picking the right table, design my studio, although I know it's kind of crappy right now, but I'm just so happy that I'm finally able to dive into this YouTube vlogging. And if you think this video helped you out, then don't forget to hit like and subscribe. See you again next Sunday here on my channel, Beyond Bedside, Sunday 9 EST.